China joins the World Health Organization's COVAX initiative with a pledge to make its vaccines a global public good. Beijing says it will buy vaccines for 1% of its population, which works out to 15 million doses. China is the biggest economy to back the initiative so far. And for a closer look at China's entry into the WHO's COVAX Vaccine Alliance, we're joined by Dr. Annelies Wilder-Smith, and she's a visiting professor at Chian School of Medicine at Nanyang Technological University. Thank you very much, Dr. Annelies, for joining us. So China, it's actually quite late in this game in joining this alliance. We know it previously declined to do so by the September enrollment deadline. So could this be seen perhaps as a U-turn on behalf of Beijing? And if that's the case, why now?
China carefully considered the pros and cons and came to the conclusion that the advantages really far outweighed the disadvantages. The COVAX facility serves as almost like an insurance policy for participants to secure access to safe and effective COVID vaccines. And it's really now the agreed upon international mechanism for equitable distribution of vaccines.
And the two other leaders in the vaccine race, the United States and Russia, they're both missing from this picture. China has the opportunity then to fill the void for a global health leadership, it would seem.
Yeah, indeed, China is filling the void. It's also signaling to the world that it wants to become a global leader. And if I may say so, China is filling the foreign diplomacy space that US has left behind.
So how big of a boost will China's participation be for the COVAX alliance then?
It's a big boost. It's a financial boost. It's a moral boost. It's a boost for vaccine development. It's also a boost for global solidarity.
And what is China bringing to the table then with this? We know that the origin is thought to have started in China, so they do have expertise in dealing with it.
So China brings in expertise. They are developing their own vaccines. China's bringing in finances, but China's also signing up to sharing information, but also being part of a global player to support an equitable access of vaccines and to support the notion that a vaccine is a global public good.
Well, we know that 170 nations have signed up for the scheme. What are their main concerns, around vaccine nationalism and as you mentioned, that the equitable distribution of vaccines?
So 170 economies signed up. That really represents almost 2/3 of the world. Why did they do so? That's because they recognize that we need an international coordination mechanism that will ensure an equitable distribution. We want to distribute vaccines to all people and not to all people, to some people in all countries rather than to all people in one country.
And how much do we know then about COVAX's distribution plans and schemes, and how can we be sure that poorer nations without the means to produce their own vaccines will get their hands on the vaccines that they need?
It really is a global access facility that has various advantages. It is providing doses for at least 20% of all countries. It's aiming for 2 billion doses by the end of the year 2021, with a very diverse and actively managed portfolio of vaccines, which means you also risk sharing, because some vaccines may end up not being so efficacious and some may be better. So they also ensure that vaccines will be delivered as soon as they are available to end this pandemic and to rebuild economies. They're also assuring a predetermined price so that it is an affordable vaccine to all countries, and that those countries that cannot afford vaccines do not run out without vaccines.
And thank you for sharing your thoughts with us. We've been speaking with Dr. Annelies Wilder-Smith, a visiting professor at the Chian School of Medicine at Nanyang Technological University.